Hello everyone, I'm your host from Research Update organization and you are watching the video series of clinical research education. You can join our Facebook group and you can subscribe our YouTube channel for the latest update. Also you can join our Telegram app, which is Q&A research interest group. We will start our session soon. Today's session will be completely on the introductory part, introduction to the clinical research. Let me tell you few instruction. On your right side, we have the chat box option. You can write your question there, and I will answer those questions afterward. As well as you can raise your hand. I will unmute you so that you can ask question directly to me. The prelim session will be 40 to 60 minutes an hour, and then we'll take Q&A quickly. Okay, and this all the videos will be uploaded either in Facebook as well as on YouTube, so you can watch these sessions there. Let's start today's session with introduction, the type of the research, and some of the people are here new, some of the people already have experience of research. Some people who is in US, they are doing residency or in medical school or applying for residency or physician. They knows what is the type of the research or how you are doing research, but how your publication or how you present your work, that is the challenge for them. The people who are not in US, for them the basic fundamental thing, what is the research and what are the type of the research, that is the trouble. So let's start with the type of the research today. So when we talk about the type of the research, in our mind, majority three different type of research comes into the mind, in our brain picture. Number one is we will talk about original, non-original later on, but number one major type, there are three major type. Number one type is observational studies. Those observational studies are the studies where there will be no intervention going on. Basically, you are collecting, or you will be collecting, or you had collected the data, and you are simply retrieving back. You are taking those data back and you are analyzing, and you are checking your aim and objective and hypothesize whatever you wish to see. So I'm just always keeping one example, one easiest example in mind, and we'll try to check that example in every type of research. For example, if I'm checking that smoking cigarette will leads to cancer or not, or the people who had cancer, they were smoking cigarette or not. So basically I'm checking here the role of cigarette and cancer. In that case, it's not recommended to or not needed to do any other studies like intervention or something. Simply observational studies are enough. And then in that case, we either do retrospective studies. So we will take the records from the back dates, and then we'll see this association between smokers and cancer, or we will today hypothesize everything. We will decide the aim and objective of our study, and we'll check in the future. We will start collecting data from today, and we will decide the date until what we need to collect or sample size, and then we will continue to collect. That is called prospective study. The third type of studies are cross-sectional studies. So today you are deciding, and whatever timing you choose today, the record will be collected only and only today. So for example, a good example will be like you wish to see the effect of meditation or yoga on hypertension. So you 15 people, you will tell them to check their blood pressure. They will check their blood pressure, have a 30-minute of session, and then right away you will do another thing, another measurement of blood pressure. Right away you can find out what is the effect. That is a kind of, it's not a real intervention, but it's a kind of cross-sectional study. Right away you can find out. Or today you want to see in, let's say, New York, what is the prevalence of the COVID. So right away I'll check the data of my hospital, and we'll find out today in my hospital 2000 patients of COVID positives are there, and out of that how many were having pre-existing hypertension. And today whatever data I'm having it, I will analyze and put the correlation between those two. So that is called a prevalence study. We'll come to that thing in detail one by one. And also some of the rare disease or some of the new disease like COVID-19, we do epidemiological studies. So let me take one by one in detail, and then I'll tell you with the example how we can go with that. So let's talk about first retrospective cross-sectional study. So here, when we talk about retrospective study, let's start about two. One is case control study, and second one I'll right away compare that with the cohort study. Okay, so usually cohorts are prospective most of the time, but we'll talk about retrospective cohort as well. But case control studies are very famous studies where usually you are looking the association of disease, and so cases means disease, control means no disease, and you are going in the back in the past, and you are looking for the association of some risk factors. So I'm checking cancer versus no cancer, and I'm going back to see the role of smoking, right? So this is the cheapest study which we can perform. We don't have to worry about the money because the data is already there, and we are just finding out today in today's file, whatever in the today's electronic health record, or some countries are having files. So we are finding out how many patients today had cancer, how many patients today did not have cancer. Those 100 will take those data and will open their records and see that they had smoking history or not, right? Very simple. And then in that case you will collect the data. We will come to the data once we are reaching to detail of those things, how to collect the data and stuff. But once you will collect the data, and whatever measurement you are getting, whatever EHR is electronic health record, basically electronic health record. In US we are having electronic health record, and in other parts of country they are having manual files. So that is the way we are collecting the patient's record, right? Some countries they are giving the record back, but in order to do the research you need to keep the record of the patient with you, right? So the measurement of the severity or the gravity you are going to get, the relation between smoking and cancer in the case control study, that you are going to get it in the odds ratio, so basically when whatever I'm teaching you here, everything is available in the books of preventive medicine or of public health or anywhere. So basically here we are not teaching a proper concept of anything. What we are teaching how to do the research, basically. So when you are reading next time, or when you are considering your research, you have to make sure that if I am doing a research kind of case control studies, I must mention odds ratio in my paper, right? So that is what we are teaching here. Now what is odds ratio? On that books over books you can read that what is the odds ratio. We will also try to teach you how you can calculate the odds ratio using sophisticated free tool available online. Okay, so retrospective study, which we call it case control study, make sure that study will tell you the odds ratio. In that study it's a cheapest option, the best option. Without resources you can perform, though you need, if that study occurs in your hospital. Today we will also have a little bit of idea about which study require IRB, institutional review board permission, or ethics committee permission, which study will not require. Also that we will also tell you something, and in future session we'll try to cover everything in detail. So case control study will give you odds ratio. That is the best study among all of them. That is the cheapest study. After doing cross-sectional study, we'll come to cross-sectional, I'll tell you. So that is also the very resourceful study, and it's also powerful study. Now the second type of study is cohort study. The people who already are in US, they probably knows what is case control and cohort, so this will be very quick, refreshing their knowledge as well. So cohort study usually are prospective. uh, uh, Cohort studies are prospective usually. If you see here we choose cancer versus no cancer, and we look for smoking, we look for risk factor. It's completely opposite. Here we went in the past, we took the record of the past. But compared to case control, in the cohort, in prospective, we will see today. You will not, if you want to do it prospective, is future, you can't predict the future right away. So here we will write we will take the history of smoking today. 100 people with the smoking, 100 people with the smoking, and 100 people who were not smoker. Now for those 100 people, we will track it for 5 years. We will track them. I'm just giving you all hypothetical numbers, okay? It's depend on what is the aim of your study, objective of your study, how you would like to continue your research, and what are the resources you are available. But hypothetically, you are tracking them in the future. Once you track them in the future, then you will see after certain duration how many will develop cancer, let's say, right? For example, so how many of them develop the cancer, and then whatever you are getting, that you are getting parameter in relative risk. So that answer, so the answer you are going to get it, let's say you got the 5, we will tell you how to get it 5 times, so you will get the answer. Compared to non-smoker, smoker are having 5 times higher risk of developing cancer, right? So this is something you are going to get it. But now you can imagine, if 5 years or 2 years or even 5 months you are tracking the 100 patients, so how many problem you will be creating. You have to keep tracking those patients. Number one, you have to spend money on that future follow-up visits. You have to make sure that those smokers, non-smokers patient will not lose the follow-up. They will sometimes forget the history, whether how many cigarette they smoke or not. So there are so many biases involved, as well as it's a time consuming, it's a resource consuming. So this is not very famous studies. It takes a long duration. After 5 years, you will try to collect the finding, analyze that, and then try to publish your finding. Now, very important thing, any research that will not publish has no value. Any research has no publication, has no value, because then you cannot tell your finding to the people, right? So it's the same thing. If you are in a medical school and you do not have a degree of the doctor, then you can't treat patients. So value of a medicine is good, but you need a degree to practice it. It's the same thing. You need to get it published, otherwise there is no value of your work, right? It will not recognize. Okay. So let's get back to the cohort one. So that's why to solve this prospective, solve this problem of 1 second, my screen. Hold on 1 second. Yes. So to solve this issue with the prospective thing, the solution has created that. We are doing retrospective cohort. Just 1 second. I think it looks like the screen stuck. So we have created retrospective cohort. In retrospective cohort, the same formula, same method we will be using, exactly same. We are not going to change anything. The only thing which will be changing, that is something called, we will be having here a smoker, we will be having non-smoker, and everything will be today. Today we will be collecting the data of smoker, we will be collecting the data of non-smoker, but what we are going to do is we will call them, or we will check their record after 2 years ago or 1 year ago, or whenever the record, let's say we'll decide 1 year ago how many patients were smoking. So I will call them, or I'll contact them through a standard system according to the standard IRB permission, and whatever we are having it, we will contact them and we'll make sure that we follow the protocols. And then we ask them, one second, hold on, just you can, yeah, I think I was like, why you cannot see the screen? Yes, so it's called prospective cohort. The same thing you will be following. You will be having 100 smoker, you will be having 100 non-smokers file, and you will be contacting the same people, the smoker, and then you will call them that, okay sir, are you a smoker till today? And the guy smoker, then you will call them, okay, come today, and we will take the history, how many packs of cigarette you are smoking, what are the other symptoms, what are the comorbidities. So today we will get that 100 smokers history, 100 no smokers history, that I'm having X comorbidity, Y comorbidity, I'm on this medicine, and similarly I'm having all history of non-smoker too. Today I'll tell them, let me pay you the research pay for them for the checking whether they develop the cancer or not, because these guys are having 5 years of history of smoking, and this guy were not smoke any cigarette for 5 years, right? So now today all the testing will be done, all the testing will be done for tuberculosis or for the smoking, or depend on the whatever the hypothesis is. And today if any of those 100, let's say five find out the cancer, right? And here we did not find out the cancer, or here in non-smoker we find out 3 cancer. So this data will be evaluated for prospective. So this is not this is cheaper than the previous resources because it's a quick study, but still here we are using risk factor, no risk factor, and today we are looking for the disease. Risk factor, no risk factor, and today we are looking for the disease. So this is prospective cohort. So let me just give you the brief again when I talk about retrospective and prospective. Okay, here I can have number 1, case control, and here I will have majority cohort. And here in retrospective also I will put a cohort, but that is the way I mentioned. But majoritarily, what is the case control? Case means disease positive, control means disease negative, and I'm looking for risk factor. Cases for disease positive, control for disease negative, I'm looking for risk factor, and what I'm going to get it is risk ratio. It is risk ratio. In cohort I'm going to get it risk factor positive, risk factor negative. Either I will track the patient from back to the today or from today in the future, and I'll see whether disease develop or not, and what we are going to get it is called relative risk. This is concept number 1, and this is which we are going to use it for observational study. Now the third type of study we are having it is cross-sectional prevalence studies. Many studies are cross-sectional prevalence studies. As I mentioned, that the cross-sectional prevalence studies will give you again risk ratio. Similarly, like this, I'm going to make sure today in the hospital, whatever disease I want to look, today only, today's record, I will open it. Whatever hospitalization occur, I'll pull the data, or this year's data I'll pull it, and I'll see that whether I'm having this risk factor in my hospitalized patient compared to I'm having this disease in my hospitalization patient, and I'll do the study. It will give me odds ratio. The odds ratio and relative risk I will share the link if you wish, if anyone wish to know that on YouTube those lectures are available, how to calculate by hand. But when you are doing your study, that learning the odds ratio and relative risk is easy by calculating by hand. But when you are having a very complex data beginning from 100 to million, right, your hospital data will be of 100 or 150. The national data of ours, we are dealing with a million patients, so then you need a sophisticated tools to count it for you. Okay, so that is the cross-sectional study. Now epidemiological studies. Epidemiological studies are the studies which will tell you the epidemiology of disease. It's a huge big word, right? What is epidemiology of the disease? Now epidemiology of the disease will take each and every studies in detail, epidemiology study, how it look like and everything. But epidemiology means it will tell you the patient's characteristics. Disease characteristics means how many patients I'm typing but it's not coming up. So how many patients were male, female in the rare disease. No one would like to know that in MI, angina or cardiac failure or some stroke, let's say, what is epidemiology? No, but everyone would like to know about COVID-19. What could be the characteristic of COVID patient? What could be the characteristic of Takayasu patient, or let's say some new disease? So we will be talking about epidemiological characteristic of such disease where epidemiology is not that known. Okay, let me show you some example and write some of the examples so you will have idea. Okay, so here I'm taking epidemiological studies. Probably I'll cover. So epidemiology studies are usually done. Yes. So let's say this is epidemiological studies. Usually epidemiological studies, it's very difficult to publish. But when we are talking about epidemiological study of rare disease, then many journals would like to accept it because many disease epidemiology we don't know. So this is one of the such epidemiological studies that when they have seen the COVID-19 characteristics for long-term care facility. So probably now by 3 months past, we all know how COVID-19 symptom present, what are the concurrent comorbidity, what are the complication, what are the different people are using different treatment. But still in long-term care facilities, people don't know probably what type of patients are involved, right? So in such case, whatever epidemiological characteristics are, they will produce in this table. Let me show you. This is important thing. When we talk about epidemiological characteristic, it's a simple study, one table. It says that demographic feature and clinical characteristics of the person who is in the facility. I mean, this is long-term facility. So those people are very old, then 83-year-old patient, if they are the patient, then how it look like, whether they are having hypertension, what will be the prevalence of diabetes, etc., etc. So this is like a epic stories, like they have mentioned everything, descriptive studies, but still it is original article. And if your hospital, if let's say for example your place where you do not have sophisticated technology to do analyze the work, no biostatistician, no one, still you can publish such study which is having epidemiology. It is publishable, right? So here we will discuss in future like what are the different tools you can use it wherever you are practicing to publish your work. It is not necessary that you should be in a biggest hospital of the world in order to be the researcher. No, you can be a researcher by practicing in a small village. Still you can publish your work very efficiently. Okay, Let's get back to our types. We'll cover today all the types. So that is epidemiological studies. Now, second type of research, interventional studies. This is little tricky. Interventional studies always require IRB permission. Always. Those are called intervention. The name suggests you are doing something, you are interventing something, you are giving something to the patient. That is why it's called intervention study. The name suggests it very clearly, right? So now, what different type of interventions available? Can't access hospital EHR data unless active employee. Yes, you cannot access the EHR data, right? So that is why some of the study you can't do that, but many of the study you can do it without requiring. We will cover that thing, that you do not require EHR. You can create the database by yourself, create the COVID database, create the other database, and so many databases for your own self. It will be little hectic, but you can do it. And there are many healthcare databases available for research purposes. Yes, they are there, so you can have those databases for your research.